we are all very comfortable with the paradigm of addiction or the model of addiction as a medical disease, but I think we can go one step further. That paradigm works perfectly well. It answers a lot of questions. We can evaluate the situation and make predictions and use medications as such. But I think there's another paradigm or model that is really important, and I think as time goes by, this is going to become more a topic of conversation and social discourse. And I feel that addiction is a manifestation of our social and cultural pathology broadly. That being the case, what can we do in that way to make evaluation, a formal analysis, and eventually prediction for treatment of that symptom and their original social pathology? This show is Reality Bites with Dr. B. This is kind of the direction we're going to go and explore. We have Julie here, who has been a patient of mine for the last couple of years, and within the greater context of addiction as a symptom of a social pathology that should be looked at much more closely. And by the way, sociologists, psychologists, social theorists are starting to look at this and trying to start to formalize words like despair and how do we address it. To that end, I am interested in the individual narrative of those suffering from substance abuse. And I think that will, over time, draw a lot out. There's a wide spectrum of different people across our culture and social landscape that suffer from this. And I think these narratives, if we start to look at them, it will draw out individual patterns that we can look at and really point to and say, you know what, from a social perspective, there's issues in our culture that we can address, that we can eventually use to treat addiction. We have Julie here today. Again, she's been a patient of mine for a couple of years. I know her really well. I know her family really well. And what I really want to do today is start from her narrative all the way from when she was born. Julie has, and Julie's not her real name. We're using that to identity protection and to give her some privacy. Hi, Julie. How are you?
Hi, Dr. B.
I've known Julie for about 2 years now.
Mm-hmm. Yeah, 2 years.
Julie, tell me tell the audience what your age is right now.
I'm 31.
31 years old. Okay. And how should we start this? We're in California. Were you born in California?
Yeah, I was born in California in Apple Valley, and I lived with my mom, my dad, and 2 older sisters in Wrightwood for the first 7 years of my life. My dad and mom got divorced when I was 3 years old. I would say my childhood, I think I was too young to know the effects of, that the divorce would have on me later. But, my childhood was a happy one. I had a lot of love from my mom, and, my dad was kind of emotionally distant a lot of my life. My mom was emotionally there for me, but maybe a little bit too much of a best friend growing up.
Your mother?
Yeah, I'd say, yeah.
When you say your dad was emotionally distant, is this something you can tell us on retrospect, or is it something you remember realizing, and how early did you realize that?
Let's see, I think I really started to recognize that as probably when I started going through puberty, and I would try and, share emotional, things with him, and he was just kind of answer me in sort of a textbook way. He's a really smart man, and he's a PhD and stuff, but he's just very, by the book, and not really an emotional response that I'd ever get from him. And I think that kind of affected me in some ways.
Do you remember the divorce at 3?
No, I don't.
Not at all.
No, I don't remember them being together at all.
Okay. All right. Do you remember any domestic strife
between them?
At home?
Yeah, definitely. They did not like each other. They wouldn't even go in the same room for really long. I mean, up until my 20s, they wouldn't even be in the same room together. They talked badly about each other, especially my mom towards my dad, which gave me a lot of preconceived notions about him that I, later found out weren't necessarily true. I think it's probably still the reason for some of my resentment is just that feeling I had about him as a child. My with my sisters, it was a pretty good relationship, especially with the middle sister. But the older one was like really perfect. She always has been her whole life, in every sense of the word. um, and I think that was a lot growing up. Kind of feeling, I guess, in her shadow, pretty much my whole life.
Now, both your parents are college educated and even graduate degrees, correct?
Right. Yeah. My mom's a nurse.
Nurse, yeah. Any substance abuse on either side of the family?
No. I mean, my grandpas were both World War II vets, so they struggled both with alcoholism. One of them died of complications due to that, and then the other one died old, I think, in his car.
Okay.
Yeah.
And so they split up at 3, and who did you go with?
My mom.
Tell me about life after that.
It was, I remember for the most part a pretty happy childhood. Up until I was about 11. Do you want me to?
Yeah, no, feel free, and if there's something you don't want to talk about, just say, I don't want to talk about that.
Yeah.
Everything's, whatever you're comfortable with.
Okay.
I just really want to get a sense of you and your placement in the world and how you see yourself, and eventually how substance abuse came into play. But yeah, go right ahead.
Okay, so I consider my childhood to have been a happy one. I had loving, supportive parents for the most part, and I think things kind of turned bad for me, I guess, when I was 11 and I was molested by my stepbrother. And I think there was a part of me that died a little bit. I was never really the same after that. And I didn't tell anybody, and that was the biggest. I don't want to call it a mistake because I was 11, but had I told somebody, maybe I could have gotten therapy, but I didn't tell anybody for maybe 8 years, 9 years after.
This was, and I'm sorry to hear that, and I already know quite a bit of the story, but this was stepbrother, your mom's husband afterwards. Right. Yeah. Mm-hmm. Was there any issues before that? Not at all, huh?
He with him,
yeah.
or
anybody?
No, not really. He lived with his mom, so he didn't really live with us. He was coming to visit his dad, and yeah.
Did you tell your mother at all? Because I know you. And that, okay.
8 years later.
Tell me, can you describe in any way, to the extent that you're comfortable, when you said things went bad after that? Expound on that. What do you mean by that? About how you viewed yourself, how you viewed the world, your sense of trust, your sense of security in your environment. And I don't want to put words in your mouth, but I want, if I can, to the extent you're comfortable, if I can just draw out the impact and how profound that may have been for you.
Sure. Yeah, it was extremely profound for my life. It, my trust in people was definitely, especially males, really changed a lot after that. I didn't really, feel comfortable being around males at first, and then, after a couple years, I kind of went into a sort of hypersexual mode, especially when I got into high school. When I was like 14, come high school, I was kind of the school slut, because I would sleep around with people, and that's just kind of how I think, and then which continued like a shame that I felt in myself. I think that's the biggest thing that happened, is that I felt shame, a lot of shame after that, and I would do actions that just perpetuated that shame.
This event occurred at 11. It was not propelled by you in any way. You didn't share it with anybody. If I'm going to understand it, I would say you had a really difficult time interpreting what that whole event was. Right. And somehow you internalized it into shame, which a couple of years later you manifested in hypersexual activity. And I think for some folks, if I understand correctly, if I recall correctly, they become very hyposexual or the reserve. Or in a couple of years, and you're saying as early as 13, 14, it sort of manifested into this hypersexual activity. What was, your relationship with him after that? Were you distant, reserved, fearful?
I don't remember seeing him for years after that. Maybe like 6 years. So yeah, it was just when he stayed with us for that weekend, and then I didn't see him for a long time. My stepdad, I was reserved around him when I had been really, really close with him before that, and yeah, he was, closer actually at the time than my own father, and then it kind of
Disintegrated?
Yeah, it disintegrated and it never really got back after that.
Did he wonder why? Was it really obvious?
I don't know. I don't think it was obvious to anybody. I think I did a pretty good job of hiding it.
You hid everything.
Yeah.
So it was almost a, existential lie in some ways, in that,
Right.
I'm not going to present what I'm really feeling to the world around me, especially those that are closest to me.
Right.
And should protect me. What about relationship with mom? Was there any effect on that she didn't understand?
I don't think that she noticed, I think I did a really good job of living my lie and letting what happened affect me and how I felt towards people. And, I tried to take full responsibility for it and not let it affect other people.
Yeah.
And just kind of take it all on myself.
What about schoolwork or any extracurricular? Did that suffer after that?
Yeah, it did.
Tell me a little bit about it. Tell us whatever you feel like telling us about that.
I mean, I didn't,
because you're a really smart girl.
Yeah.
I know you're a smart girl.
Thank you.
And when I, in fact, first met her, when she came, I'm going to take a little side trip here. When I first met her, she came into my office, and, this is a substance abuse medical office, and, it was obvious it's heroin. I just asked her, I said, are you here for heroin? I mean, you look like a college swimmer. And, she's such a gracious, wonderful, kind-hearted young lady. And I was, and this was 2-3 years ago now, huh? Maybe even 3
About
years
3,
ago.
yeah.
Yeah, so there was an impact on your extracurricular and school activities.
Oh, yeah. I mean, I'd say pretty much my whole life after that, I kind of had trouble, See, I don't want to say it's like my whole life is because of that one moment, but it's how it snowballed after that that led to the rest of my life, is where I kind of, I allowed myself to get distracted by guys and by, the things that I was getting into to maybe cover up, the shame I felt about my actions. And, I've never really been able to stick to finishing things, and that's been kind of the
motto, the theme. So in high school, you started to have this sort of different social interaction. Mm-hmm. Go from there for us. What happened from there? What, your grades were suffering?
Yeah.
And then you told me, I think you dropped out.
Yes, I did. I ended up dropping out as a sophomore for a couple reasons. For one, I just couldn't. I've always been kind of had a head in the clouds, I guess, but from there, once I reached, middle school, high school, I had no care at all for school, and it was just, I saw it, purely as a social thing, and I don't even remember paying attention at all in my classes. And I think, I dropped out as a sophomore because I had a really bad reputation, and I was getting bullied by some of the girls there for sleeping with, their boyfriends, and it was not really a good thing for me.
That's tough. So from that 11 to 13, 14, 15, mm-hmm. I'm going to stop and let's discuss another aspect of all this. Had any substance abuse started yet? Or use, or whatever you want to call it. Was there alcohol, was there pills, cocaine, any?
Yeah, well, I mean, I'd say the first time I used was drank. And the first time I drank, I got hammered, blackout drunk. And, I started using on a regular basis.
What age did it start after this event?
15. Well, the first time I drank was after this event, but I started smoking weed on a really regular basis when I was about 14. 14 to 15, 14 to 19 really. I smoked probably almost every day, and smoked weed. And, I was really experimental. If there was a drug in front of me, I would try it. Cocaine, mushrooms, ecstasy.
Opiates?
Pills. I got hit by a car when I was 16 walking to my house, and I broke my tibia, or cracked my tibia, and I was prescribed a lot of pain meds, and that was my first taste for Norcos, is what I got.
What age?
16. Yeah, and they gave me a lot. Yeah.
So, tell me, I'm going to recap it. Within a couple years after that event, not only there was social sort of mayhem and discourse in your life, there was out the internal turmoil that you said, but the substances started, and it included anything and everything without judgment on that.
Pretty much, yeah. Yeah, but the one thing that I noticed really like fit like a glove was opiates. Yeah.
After the tibia?
Right. Yeah, as soon as I took them, they just like, the best way to describe it is it just made everything okay. I didn't feel any pain anymore, emotionally and physically, and I felt like I could be, happy and bubbly, and, I didn't have to pretend so hard, and it just came naturally, and everything was okay.
This is an interesting phenomenon where you get with opiates. You hear this a lot from a lot of different people. We know opiates are affiliated with what we call a euphoric effect, right? Getting high, whatever you want to call it. But really, many people you talk to over and over again, they describe whether it's feeling normal for the first time in their life. And I think saying it takes away the pain is too much of a description, because it just simply puts you where we're supposed to be as humans, which is at ease in our world, right? And however you came to that place where there's no ease, the opiate sort of puts you at ease. And that is the deadly draw. So this was about in high school, huh?
Yeah. Yeah.
Or when when
I dropped out.
What were you doing when you, and what was your relationship with your mother by then, your father by then, and what were you doing if you dropped out?
Okay, well, actually, that's actually what led to the dropout, was that when I broke my, when I fractured my tibia, they said I didn't have to go to school for a couple months, and I just never went back, basically, yeah, and my dad was, I think I lied to my dad, I didn't tell him. My mom was kind of at the point where she couldn't really control me, though she tried. And, she kind of just let me at that point do what I was going to do. I think that was really her only option.
Why?
Understand.
Why do you say that was her only option?
I mean, maybe it wasn't, but...
Why do you think that? I mean, you said it, and it might have just... I'm not pinning you, or...
Right.
I'm just curious why that is the thought, that you think you put it back against the wall?
Yeah, I do. I think I was a wild child. I think that I was going to do what I was going to do. And it was, I mean, maybe there could have been somebody, who could have had better control over me, but she's not. She's a really kind-hearted, sweet lady who's I mean, I'll be honest, is easy to take advantage of, and I used that to my, I used it. I manipulated her.
And what were you doing when you weren't going to school? And tell us what was the next major evolution in your life circumstances?
So let's see, I was 16, I was dating a 27-year-old, and I dated him for 3 years till I was 19. And, I didn't really get hooked on any, he was a coke dealer, but he didn't so I did coke every once in a while. I didn't get addicted to that. I didn't really have a way of getting opiates, so I didn't do that, but I was smoking weed every day and doing hallucinogens whenever I could get them. I broke up with this guy when I was 19. I moved in with a girlfriend of mine, a female friend, and I started stripping at that point because, I found out I could make a lot of money, and it was just, it seemed like a natural thing to me, I guess, because I had never really given much, care to being conservative with my body or my, sexuality. So it was an easy, natural thing for me to do where I made a whole lot of money, and so I did it, and 6 months after that, I found somebody who, sold heroin, and,
This was at the age of 19.
20 is when I finally, 20 is when, right around my 20th birthday.
So from 16 to 19, you were dating this guy. You were still living at home?
Sort of with him. He was horribly abusive to me, like cheated on me a lot, and yeah.
And what was your relationship with mom like?
I think it was okay. You know, I it was okay as long as I could go out and do whatever I wanted to do. You know, I was a brat. Yeah.
So 16 to 19 with this guy who's 11 years older than you,
Right.
abusive. He moved in with a girlfriend at 19, started stripping,
Right.
and at 20 you found heroin.
Mm-hmm.
And tell us about that.
That was Norco's times 100. It's like that basically.
Did you smoke or inject?
I smoked it. I didn't inject for years later, but I have never gotten away from that addiction ever since I tried it. It's either I've been on heroin, or the times that I've been able to maintain a clean time is I've had a couple years at one point, and right now I've had a few months, and that's thankful to Suboxone and Sublocade right now.
Yeah, we're gonna talk about those.
Yeah. But it's been 10 years of my life, 11 years that.
When did meth come in, or any other stimulants?
Meth came in at about 24, I want to say.
What were you doing from 20 to 24? Tell us any significant things there. You
got
away from the abusive guys.
Got away from the abusive guys.
You were stripping. What were you thinking? What was the plan in life? What was mom saying? Tell me some of these things where, someone on that, I kind of understand it. I see that kind of like, there's it's just basically driven by the emotional status of the moment.
Sure. Exactly.
And tell me if I'm wrong, you're, essentially, as the Chinese say, is chasing the dragon, and there's no such thing as a dragon.
Yeah.
But explain to me, try to relate what was going on in your head, what that day-to-day thing, and what were you hoping to achieve?
I think that I was kind of living for the moment at the time. I don't think that there was so much of a plan for the future, though my dad has always been really about education. Sure. And has always instilled that very deeply in us to be, something that's important. So I stayed in school. I had gone onto like community college, and started doing that on, a regular basis. I was, every semester. And I kept that as a goal of mine, but I was never really able to stick with anything, and I was in community college for like 5 years. I got into, university 3 times, but, I didn't go. And, none of the 3 times I actually followed through and, completed what I needed to complete in order to, fulfill the requirements of, getting in the next semester.
I remember one of the times it was Cal State, right?
Yeah, right. All of the times were, yeah. And so, that was kind of just a constant theme. I would get to this place in my life where it's like, okay, things are going to start changing around. I can get out of what I'm doing and go on to what maybe I'm meant to be. And I would just, I would ruin it. I would do something in my action to hold myself back to make sure that I didn't get to that.
Self-sabotage?
Self-sabotage.
Every time?
Yes. That's the theme of my life thus far.
From 24 on, so now we have heroin involved.
Right.
We have and meth involved. And it's intravenous at this point at times?
Yeah, probably. I think that didn't really go until I was about 26. I had a couple of years of sobriety between 24 and 26. It was a really, really good time in my life. I was on low dose, long-term maintenance of Suboxone. I think it was like taking 2 milligrams a day or something. And then, it happened again, and then it was going full on like intravenous.
What was the event that made that relapse?
It's always the same thing. I met a guy. I met some, a-hole guy that was, not good for my life, and I would run off with them and yet again self-sabotage through these guys.
Do you know why? I don't know why. I want to know if you know why. Can you shed some insight for me?
No, I don't really know why. I think I'm sure it all has something to do with the way in my early life how I looked at men, this like just trusting. I don't know. I honestly don't know. I don't.
So when you run into these guys,
Yeah.
okay, so you know that the little thing they always say the definition of insanity is doing the
Right.
same thing and getting the same result.
Yeah.
You know, let's say we walk out of here and you meet one of these guys. At some point, we get tired, or we it should be this way. Certainly, I have things in my life, and I'm not putting any kind of criticism on you, but I just
Yeah.
want to know what happens. At some point, we get tired when we do that thing that doesn't produce results, and in fact
Mhm.
produces negative results. All those in your 20s,
Mhm.
you never felt that, or where you could just walk away from it, say, I'm done, something in your cerebral cortex just clicking, saying, this does not produce healthy results.
Right. I think that what I really became addicted to was always feeling good. I just wanted to do things that made me feel good. And despite the fact that these guys weren't good for my life, they made me feel good. And they produced an excitement and, mixed with the drugs, it was a euphoria that was hard to get away from, you know?
But I've seen you suffer the consequences
Oh,
of that, right?
yeah.
We know there's been, issues with law,
Right.
issues with money,
Sure.
issues with homelessness. You
Right.
have so much potential in education,
Right.
and that doesn't deter.
I mean, it does.
I mean, I think we're getting there. We're going
Yeah.
to get to where
Right.
you are right now,
Yeah.
and I think you're doing amazing. I've always
Right.
thought you do amazing, but
Yeah.
in those years, that just
It didn't. No, I mean, I think that it did. There was always, my logical mind that knew what I was doing was wrong, and this was not the right person for me, and this wasn't the right, trajectory I wanted my life to go in. But despite that, I was impulsive, and I wanted to go to the easier, feel good way. And yeah, I think.
if you would give us a quick synopsis from 24, 26 to now, and then let's talk about now. I
Yeah.
want to
Okay.
know where your mind is at now, where your thoughts at, and where we're looking for in the future. Because I'm very proud of you, and I
Thank
think
you.
that's a wonderful part of the story to tell we're at, and then really talk about the long-term sequelae of this and what I think, because I will give you my definition of hope.
Right.
But tell us a little bit about that.
So, yeah, so between 26 and 30, I had, it got worse, got much worse than I ever could have imagined. I had about 2 jail stints. This guy that I met that broke off the 2 years of sobriety was, ended up trafficking drugs and getting into a federal case. I married him, by the way, just to make it bad things worse. I married him during that time, and he was trafficking drugs. Got a federal case, and I got a gun charge with him, his gun, um, and yeah, I was on 3 years of high control felony probation. I messed up from that probation, went back to jail, and I'm off probation now, and I don't know. It's yeah, and then I think the present is, I guess.
The president's
It got worse, yeah.
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 And it's been constant again,
Yeah.
trying to stay clean for a couple months. The poly substance with the methamphetamines and heroin, different guys and stuff.
Right.
But let's talk a little bit about where we're at now. I think you've been doing amazing. You've always done amazing, and I'm going to define addiction and the way it should be approached. Because I think you're a wonderful example of it. But tell us about now. Tell us about what's going on. Tell us about your feelings, what you're doing, your personal life, and your ambitions, and we'll get into that. But go ahead.
Right. So I mean, I just to rewind a little bit. I met Dr. B a few years ago, and it was really been a blessing to my life. He's always been there for me ever since I met him, and has been kind of like a hope I've had, I guess, of he's helped me a lot. And so when I went to jail this last time, him and my mom were in contact, or you and my mom were in contact, and made kind of the executive decision that when I got out of jail, immediately I would be getting the Sublocade shot, which is essentially it's a Subutex shot, and that would just be happening immediately. And that's what happened. I got out of jail, I got the shot, and it's been
3 months?
4 months? Yeah, this will be my fourth one coming up
great.
soon. Yeah. So, it's been amazing. It's like I was telling you in the lobby, it's kind of like, it feels like that, whatever made me a heroin addict switched off. It's amazing.
So one of the things we did with Julie here is Suboxone works great for her, but again, she's I guess I'm going to say her disease, and I'm really hesitant to call it that, but whatever it is, this thing that we're dealing with is so bad where her frontal cortex, which is the executive part of her brain, has so much control over her decision making. And her problem is she just decides not to take the medication. And if she doesn't take it, even though that medication should be taking away withdrawals, cravings, all of that stuff, she makes that executive decision not to take it, and then she gets in trouble. So with the reason we made this decision with Sublocade, and Sublocade is basically a shot of Suboxone, that's the company that puts it out, is that it's good for a month. Okay? So we decided to take the choice out of it for her. Of course, if she agreed to it, not, we didn't force her and chain her down. And she was very down with that. And since then, I'm happy. I'm not surprised because I knew she can do it. And she has had very, very good progress in the last few months. Yeah. We have tiny little ups and downs with different issues, but she has been doing well. Tell us about how well you're doing, and tell us about, give me some, and I'll give you some feedback. Tell us what's been going on and why you're doing so well. You're saying the switch got turned off. Yeah. And what else are you doing?
It's like I feel like I did back when, after like having a year and a half of sobriety last time. It's like I wake up every day and I feel happy and I feel content in my life, that feeling I've always wanted. And I'm able to just kind of live like a good, happy, normal life where I work out a lot. I'm planning on going to nursing school pretty soon. I'm applying to nursing school and trying to finish my education. I've got, plans and goals for the future. I have, my relationships with my family is on the road to being, mended. And it's like this is the most hope I felt in a really long time, because I feel like it's like I can't make these. I've been given like my life and I messed it up. Like I need to like take the responsibility out of my hands, and just medical science is what's going to fix me. You know what I mean? And I feel like that's what's happening, and I'm really grateful.
To some extent, medical. Yeah. I'm going to put it differently. I'm going to say medical science is assisting you to put responsibility back in your hand. Right. That's all. We're just, I think it's a little bit just like, as you know, I use a cane, and so. I'm not putting where I want to go in the cane's hand. Right. I'm using the cane to get to where I want to go. Okay. And I'm going to say this to you. Yes, me and your mom are kind of tough and we take control. In fact, the last couple of weeks, I get upset at because she doesn't do the little check-ins we have. But I feel good because her mom's not calling me. Right. So I know everything's okay. That being said, the goal is to get you to a place where you're completely autonomous and reliable in that way. Right. And this is where the idea, let's go back to the disease model. It's a chronic, relapsing, remitting disease. And I'm going to use an example here to make the point of why this is important. Initially, you don't know if you have diabetes. It gets worse, it gets worse, you get sicker, you get sicker, you get sicker, and then boom. You end up in the ICU with certain conditions that are manifestations of severe diabetes, and you're almost dead. You get taken care of. You come out of the ICU. Now you start very intensive medical care, which someone else is in control, right? They actually tell you what you're supposed to eat, what you're supposed to do for exercise, how you're supposed to take your medication. And over a certain period of time, the intensity of care that the doctor or the medical team does gets less. And your medication management, your disease management, your health management goes back into your own hands. And you're managing this all from home, and you see me or the doctor for your diabetes maybe once every 3, 4, 5, 6 months. And when you have a small issue, you don't wait until you end up in the ICU again. You immediately give me a call and come see me. And that model is a wonderful way to look at substance abuse and addiction. So we never ever, in fact, my whole goal is to empower my patients and eventually to get society to look at it in that way. So that's our goal. And keep in mind, being on medication allows those pathways in your, as you develop new memories and new habits in everything you do. Me and you met on time today. You were wonderful about it. You show up to your classes. I think you're doing some work on the side right now, which is great. You're getting along fine with mom. And the goal is to build habits that are new memories, and these really translate into physical changes in your nervous system. That being said, that's at the physical level, but I'm really interested in the social level. Some events in this world, in your case, have brought us to here, I believe. I truly believe that, okay? And let me ask you, are we addressing those in any way?
I have a therapist that I meet with on a regular basis. We meet on a weekly basis. It's been going really well with her. I feel like I've done a lot of work on, as far as my sexual issues, and I think that I have, I don't treat myself in the same way that I used to. I treat myself with more respect and love. I try to, treat myself with love, and it's something I'm working on, but I think I've gotten a lot better at it. I'm getting better at protecting myself, I think, and not abusing myself. Yeah.
And I think it's important to kind of look at this and really realize with hope, not with discontent or sadness, that we don't need to have an end point to this. Right. And there may be no end to this. And that's not a bad thing. Right. That is, it's just growth and development, and addressing dysfunction, and a plan to do this lifelong. Right. And remember, the diabetes patients, we want to make it so he's got no ICU admissions. Right. And that's okay.
Yeah. Yeah, I've already kind of come to that conclusion that I'm like, if I have to be on this medication for the rest of my life, that's fine. I'm not even looking at any sort of like end point in that, because this is the disease I have, it's
the medication and the psychosocial, the behavioral therapy you're getting,
all of that, yes.
And really rediscovering yourself as a human being. Right. And what is the problems with the social milieu that we're operating in with substance abuse and addiction? Number one, for the most part, a good chunk of the industry and social and cultural attitudes have such a misunderstanding of this issue, okay? When you send someone to detox, 30 days detox, and whatever you're paying, whether your insurance is paying or you're paying 60, there's no such thing. There's so much behind this issue that all that is acute care management of withdrawals and addressing the fundamental issues. So, and then the other sort of paradigm, that there's so much social controversy, and it's really it's almost dysphoric, but the idea that this is your responsibility. Well, I'm going to beg to differ, and I'm going to argue that as we go through life stories like Julie's and we look at these narratives, we're going to start to see patterns that evolve, patterns of despair, patterns of loneliness, patterns of existential issues that translate into all kinds of things like depression, anxiety, substance abuse. And those are patterns very unique to our society and our culture, and other ones as well too, but ours as well. And until we address those, and until we are comfortable with, as a society, of embracing this disease and enabling all of the folks that suffer from it to get somewhere without having punishment. I can tell you right now, I don't care what the issue was. But to put a federal charge on somebody like Julie, we're not really helping her. We're impeding her progress. But I think as a society, if we start looking at these markers and realizing that there is something we can do socially and in terms of our public policy, our health policy, we would be much further. Before the show, I was using an example with Julie here and talking about, look, there are certain societies where actually cocaine comes from, and in the Indies and South America and so forth, they chew coca leaves. Okay? In this society, if you open a textbook, I'm going to say to you, cocaine is one of the most addictive substances, and it's a taboo. Uh, Here's the thing. The guys in South America, the producers of the plant, the folks that they use it within their cultural context, I don't think you can call them addicts. They might have physiological dependence, but I got pretty severe physiological dependence in my coffee, okay? But it's not destroying my life, okay? So this is even more evidence for the fact that this can be described as a manifestation of some social pathology. And little by little, I'm going to start hinting at that. But I think it's important that we embrace people like Julie with the proper harm reduction medical care, which is very possible and done across the planet, and open up ways and explore ways where we can address this issue. And here's where hope comes in, and truly medical science of a chronic disease. They're sort of sisters. You don't give up. Right? Yes. You don't give up. Your clinician shouldn't give up. Right. Your family shouldn't give up. Right. And the system shouldn't give up, because we will make progress and we will impact a lot of lives for the better.
Absolutely.
I want to really thank you for doing this with us today. I think sharing this story, hopefully it impacts a lot of people that sees this, that gain a new insight both on the individual narrative of this horrendous disease, and as they find, whether it's compassion, whether they find science, whether they find some sort of new understanding of what it is to treat this. I'm hoping for something better tomorrow, and I personally have a lot of hope for you. And it's been a sheer joy being your clinician the last couple of years.
Thank you, Dr. B. Thank you for having me.